in order to attract the medical tourism in the country, you need to have a perfect health system. And you should be able to have facilities which deals with that item. Now, government facilities might not be able to deal with it because it's free, unless they put charges. And the second is, and the number of beds in the hospitals and other things are not enough for the population. So that, I think, is out of the horizon at the moment until the health system of the public health system to be developed a little bit more and make availability of the facilities in order to do this. The hospitals are very busy, and the primary health cares are not the place to have a tourism. The private sector can do it now, and not many of them, but some of them can do it. And I'm not quite sure if that thinking is already going on in the private sector or not, because they already have enough people from Kuwait who is going to them. But eventually, in the long run, it is possible. But at this stage, I think we should concentrate on a number of things which needs to be done to make the health system more efficient and to be able to use the facilities in a better way. Now, Kuwait, between the primary health cares and hospitals, there is no connectivity. So the patients come to primary health care, get the treatment, but for certain things has to go to the hospital. So the response from between hospital to the primary health care is not always easy to see what he got in the hospital, what he got in the primary health care. What is needed to be done is a network of the electronically which connects all the primary health cares to the general hospital to start with. And we have done that. And we have already finished 3 governorates out of 5 which they have primary health cares, and or general hospital they have. And we are working on the 4th governorate, which is Ahmadi governorate now, which will be done finished by beginning of February. And beyond that is 1 more left, which we'll do it before the end of March of this year. That means the whole Kuwait is on one network. And no matter where you go, your file shows electronically of what you have taken and what kind of treatment you had and how many times you have taken the drug. At the same time, we have agreed with the ministry that we put the standard of care electronically in the system, where it will help the doctor to make the decision of, for that condition, what kind of drug to be given. Having said that, we still have to train the primary healthcare professionals in order to be able to deal with the chronic conditions, because the chronic condition, it was not most of it, especially diabetes, was not what we were teaching at the medical school before in the South or countries of the South. And so the knowledge of how to do this, especially right now, is not as that level. So we are we have planned to retrain the primary healthcare professionals or health system group, and in order to be able for them to come to certain level of the knowledge that they can deal with the diabetes. We are talking about 500, and we are doing this with the University of Dundee in Scotland. And our electronic health record also is what we are providing in the collaboration with University of Dundee in Scotland and also with Harvard Group in Boston. So we will have the knowledge of the other institutions with us in order to move this to a different level. And I think for that we're going to be very unique in the region. We're going to be very unique in the world of what we do. Between the standard and between the standards we are putting in, between the way the package of dealing with a patient, or I say individuals, is very different. It has got basically under this house here, in here, that it is the tertiary, not the first, not primary, not secondary, but tertiary, which is knowledge-based institution, we are able to give the person who's coming, the patient who's coming to us, the total package between education, between research we do with him, and between the clinical support, which includes everything. Under this umbrella, you can do everything. We have even a walking track, swimming pool, exercise place to show them how to change the lifestyle. And we also have the cooking class, for example, for healthy cooking. And we have a lot of training for the public, whether diabetic or not, because there is, on the public, on the individual, is a responsibility of their health, which they need to apply it. It's no good to eat so much, and then you get the diabetes early, and you don't know what to do with it. There's a lot of things they can do to take the diabetes to a later age, and so on. Plus, we have a genome center here, where we look at the relation between genes and the diseases. And this is not for really understanding what gene is compared to the disease, but actually using that in order to make the prevention and educate people what to do in order to delay having the disease by years if they know they're susceptible to get this. We have 50 projects already ongoing in here, research projects we have, which is ongoing in Dasman. And most of them are related to the condition and information that we like to see of the diabetes and its complications and obesity and other areas that both for Kuwaitis and non-Kuwaitis. It's a whole population we have to look at. Because also diabetes, you can find it in the non-Kuwaiti population. And they are actually be treated also in the hospitals here. So we're going to look at the total package of what it is and what they need to do. And we try to make sure that people will be able, especially at the age of between 5 and 11, what they can learn to prevent what is happening today in that age group.